This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. Hope your day's off to a great start. Got a couple of guests joining us this morning. Dr. Matthew Gaskill, Electrophysiologist at Mon Health Heart and Vascular Center. Good morning, Dr. Gaskill.
Good morning. How are you doing?
I'm doing quite well. And also joining us is Arrhythmia Health Coach, Chris Hedio. Good morning, Chris.
Good morning, Dave.
Well, guys, thanks for taking a few minutes out of your Monday morning to spend some time with us. We're going to get into talking about AFib treatment, and we'll get into that subject matter here in just a moment. But first, we'll talk to our guests a little bit. Let's see. We'll start with Dr. Gaskill. Just tell us a little bit about yourself, where you're from, your training, and how you ultimately ended up with Mon Health.
Sure. Well, I am from Illinois, in a small city in northwest Illinois called Dixon. And from there, I wanted to training in Chicago for undergrad, and then I went to med school in Kansas City, and then I did some training for internal medicine just outside of Detroit, Michigan, followed by cardiology in Michigan. And then I went all the way over to Boston for electrophysiology training, and that led me here to West Virginia. And
what's it been like? What's been your experience with Mon Health since you've arrived?
It's been a great experience. Part of your question, why did I choose Mon Health, was not only is Mon Health a leader in heart care in West Virginia, but it's such a collegial atmosphere. I was struck by how everybody who works there knows each other and works so well together, and I couldn't help but be attracted to come here and join that team.
Chris, same questions to you. Tell us about your background.
Yeah, so I'm actually from Fairmont, so local boy. I got my undergrad at Fairmont State University in exercise science, went on to do some post-grad work in human biology and pre-chiropractic at Life University in Atlanta, Georgia. Got my feet wet in medically based wellness down there in Georgia, came back, worked in cardiovascular and pulmonary rehab, and then moved over here to Mon Health. And kind of exactly what Dr. Gaskill was saying, you know, everybody here works really, really well as a team, but not just that, you see the patients treated really, as it says, like family. I mean, everybody's treated really good, the staff really cares about all their patients, and that was just a big attractor for me.
And we're going to get into treatments in atrial fibrillation here in just a little bit, but Dr. Gaskill, explain for me what exactly is an electrophysiologist?
I always like to tell my patients, basically, I'm an electrician for the heart. If you think of other heart doctors that put in stents when you have a heart attack, I like to call them plumbers. And so I deal with the electrical conduction system of the heart. So I deal with abnormal heart rhythms, whether it be a slow heart rhythm or a fast heart rhythm like atrial fibrillation, or syndromes in your conduction system that might lead to sudden cardiac death. So I deal with kind of a wide range of cardiology, but primarily anything that has to do with the conduction system of your heart.
And Chris, you're an Arrhythmia Health Coach. All right, you've got to explain that title a little bit. What's your role?
So what I do is I kind of tag along to the care of Dr. Gaskill and, of course, other cardiologists, the plumbers, like he was saying. I take a look at 4 categories, you would say, per patient. One is nutrition, because that is the biggest thing that everybody needs to work on. The other is their daily activity, trying to get them more exercise and build something around what they can and can't do and what they like to do. I look at their stress levels and help them with stress management techniques. And then the other portion of it is I do look at their cardiovascular care and see their medications, because that comes into play, and kind of work off those things to just help them become better, healthier people.
All right, guys, we're going to squeeze in our first break, and when we return, we'll dive into AFib treatment and how both of you can play a role in that for the patient. We're talking to Dr. Matthew Gaskill and Chris Hedio, Mon Health Heart and Vascular Center. Of course, February's Heart Month, of course. And you're listening to Mon Health Talk here on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests today, Dr. Matthew Gaskill, Electrophysiologist, and Chris Hedio, Arrhythmia Health Coach at Mon Health Heart and Vascular Center. We've talked about AFib, I think, several times, to say the least, here on the program. But Dr. Gaskill, remind folks, when we're talking about AFib, what are we talking about?
Well, atrial fibrillation is a very, very common abnormal heart rhythm. And specifically what it is an abnormal heart rhythm that comes from the top chambers of the heart, particularly the pulmonary veins. And that leads to an irregular heart rate and heart rhythm. And it also increases the risk of stroke.
And as far as treatment of atrial fibrillation, what kind of treatments are available? What kind of treatments are you involved with?
Well, specifically with atrial fibrillation, there are a few main things that we want to address. Number one, as I mentioned earlier, it's a very increased risk of stroke with atrial fibrillation. And so in the appropriate setting, we'd recommend blood thinners to reduce that risk of stroke. And if maybe a blood thinner isn't working well or it can't be tolerated, there's also the Watchman procedure that we offer. And secondly, atrial fibrillation has a tendency to go very rapid, and so it's important to keep that heart rate under control. So we'll likely give medications that can keep your heart rate from going so fast so it's not such a strain on your heart. And we also offer medications and procedures, such as ablations, to help keep you in normal rhythm. Sometimes people do a lot better when they're in normal rhythm, of course, and so whether it's with medications or an AFib ablation, we do those nearly every day to help significantly reduce someone's burden of AFib recurrence.
You said you're kind of like an electrician for the heart. So how does that kind of role factor into treating AFib?
Well, atrial fibrillation is an electrical abnormality that comes from the top chambers of the heart. And so by employing medications we call antiarrhythmics, or with that ablation procedure, I'm, in a way, sort of manipulating, if that's the right word, manipulating the heart into maintaining normal rhythm.
And Chris Hedio, Arrhythmia Health Coach with Mon Health Heart and Vascular Center. All right, where does your role come into the treatments of AFib?
So with AFib, you'll notice some certain things come into play with that. Nutritionally, caffeine is one. So we try to get you to reduce your caffeine intake. Not totally in some cases. I know a lot of people like their coffee. But just trying to find a way to get that down. Sodium, because when you have a lot of sodium in your diet, it tends to cause you to hold fluid, which increases your blood pressure, increases your heart rate a little bit, which of course can kick you into a higher rate of AFib. And then of course with the exercise, naturally when you do that, it relaxes the blood vessel walls when you're done, so it brings down your blood pressure and naturally slows your heart rate down.
Chris, it sounds to me like you've just hit on the big three, I call them, that we mention, I think, almost every week on this show. Diet, exercise, and you didn't mention quitting or don't start smoking altogether, but I would imagine you throw that in there as well. I do.
Nicotine has a tendency to constrict your blood vessels, which of course does the opposite effect of what you want. Speeds up your heart rate, makes your blood pressure go really, really high. And of course you can't oxygenate as well, so it makes it a little bit harder for your muscles and your brain and everything like that to work properly.
I want to pitch this question to both of you because I'd like to hear both perspectives. And Chris, I'll toss it to you first. How does the team approach here? Not just a procedure or some type of medication, but also incorporating the lifestyle changes you're talking about. How does that all work to the benefit of the patient ultimately?
So one thing that I tell my patients is they are less likely to have a recurrence through proper exercise, diet, medication management, and stress management, and also less likelihood of having a stroke. We do reduce that risk factor with diet and exercise and their medications. And, of course, just making them feel an overall healthy, safe lifestyle to where they can go out and do the things they want to do without worrying day in and day out, am I okay?
And Dr. Haskell, kind of the same question to you. You can go in, do a procedure, prescribe medication. So why is it important that the patient also works with someone like Chris?
Well, definitely. It certainly is a team approach. I can offer medications and procedures all day long, but if the lifestyle modification changes aren't there, I'm probably not going to have much of a result in what I'm pursuing. The other factors that increase atrial fibrillation risk are certainly being overweight and or sleep apnea. And if we can address those things with resources such as Chris, that certainly helps increase our efficacy in reducing your atrial fibrillation.
Talking to Dr. Matthew Gaskill, Electrophysiologist, and Chris Hedio, Arrhythmia Health Coach, Mon Health Heart and Vascular Center this morning, and we'll continue our conversation right after this. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Dr. Matthew Gaskill, Electrophysiologist, and Chris Hedio, Arrhythmia Health Coach, Mon Health Heart and Vascular Center. And Chris, we kind of touched on it a little bit, some of the lifestyle changes you can make after the fact. What about lifestyle changes you can make beforehand that may prevent arrhythmias and AFib?
The biggest thing you can do is take a look at what you're eating day in and day out. Write it down. I have all my patients do a 5-day dialogue. That way we can sit down and look at what you're actually putting in your body. And then you can start to pick out little things. And I always say little things and small adjustments, because when you overhaul your diet and go on, like a fad version, or just say, I'm cutting out, X, Y, Z forever, you're likely to fail. It's just easier to take little tiny pieces here and there and just reconstruct it to where you can eat the things you like and enjoy your life.
Is it about moderation?
It is about moderation. And I employ several tactics of my own with patients because, everybody's different, to show them how to eat proper portions and control what they're intaking at all times.
And there's an overall benefit here as well. Not only are you going to prevent or hopefully prevent the conditions we've talked about this morning, but it seems like I have this conversation with doctors and nurses and staff across the spectrum here on Mon Health Talk. When you watch your diet, get some exercise, and again, don't smoke or quit smoking, that helps every other possible condition that could pop up down the road as well.
That's true. Just making one small change and doing it for 28 days, about 4 weeks, you make a permanent lifestyle change at that point. And then you move on to the next thing. Rome wasn't built in a day, so take your time with it and, just revel in the process.
Dr. Gaskill, we haven't mentioned yet this morning, but we need to. Mon Health Heart and Vascular Center is the first and only AFib-accredited hospital in West Virginia. That sounds great. Probably looks good on a plaque on the wall, but to the patient, what does that mean?
What that means, short and simple, is if you choose Mon Health for your treatment for atrial fibrillation, you've come to the right place. We've gone through, in order to get that accreditation, we had to go through an extensive evaluation from an outside agency, and they looked at how we treated patients with atrial fibrillation, both in the inpatient setting and the outpatient setting, and how we followed up and treated those patients. And not only did we meet those standards, but exceeded them.
And Dr. Gaskill, how would someone know if, or how would they suspect AFib or have an arrhythmia? Is that something you'd be able to detect on your own? Is that something that you would get that would be picked up, during an annual physical? How would you know if that's something that you need to get checked out?
That's an interesting question because it's a little bit different for everybody. Most commonly, people feel palpitations or maybe shortness of breath or chest pain even, and even some people can't feel it at all. Oftentimes, it may be missed on an annual physical because AFib can kind of come and go, so you may not be in AFib all the time. But if you detect an irregular heart rate, or if you have shortness of breath or palpitations, even lightheadedness, those would be signs to maybe take a look. And even things like Fitbits, or especially new watches these days, like Apple Watches, can detect atrial fibrillation pretty accurately.
We were just talking about that last week, and I asked, do these really work, or is it just, Apple trying to sell me another watch? Because I've got my watch. It'll tell me what my heart rate is, or I think they do blood pressure. I haven't looked at it in a while, I'll admit. But it's really kind of amazing that there's these things that can monitor and can actually alert you now to some some conditions that may have otherwise gone unnoticed.
Yeah, no, I can't speak for the other brands out there. I'm no expert on on watches, but I know that I'm not making an advertisement for one or the other, but I know the Apple Watch is FDA approved actually in detecting atrial fibrillation specifically. It's just that accurate.
Yeah, it's very annoying sometimes. Hey, you need to get up and move a little bit. Yeah, I'm aware. I'm aware. Hey, Chris, we've talked a lot this morning about prevention and maintaining it. So, what is your goal when someone comes to see you? What is the goals that you are going to set for those patients?
I would like to see them achieve fitness goals, and I like to allow them to set some of those on their own. And we make, of course, short-term goals and long-term goals, because if you have the short-term interspersed in between the long-term, it doesn't become as daunting. You actually feel like you're getting somewhere moving forward. We set nutritional goals. And, of course, I really like to see people do daily self-awareness, daily meditation, or just relaxation, kind of relieve some of that stress. Right away, I tell people when they come in, if they're able to, start walking. We need to start walking, and it doesn't have to be the same time every day. It doesn't have to be for a certain period. You can do 5 minutes here and there, and over time we build up to 30 minutes and then move on to other things. And as I said with diet, it's let's reduce your sodium, let's reduce your sugar, and we do that one step at a time. They meet those little goals, and then suddenly, they've lost 10, 20% of their body weight. They feel better, have more energy, and, they're happy to be around.
Do you often deal with folks who maybe, were athletes at some point, maybe in high school or maybe low-level college or maybe even Division I athletes, that it can be very frustrating that you sit there and here you are 20 years, 25 years after the fact, Chris, and you can't do what you used to be able to do, and you can remember when your goals were lifting 300 pounds or running several miles, and here we are setting goals of, hey, let's walk 2 miles today, or whatever the case may be. Do you often find people can be frustrated when they think about what they used to be able to do versus, looking ahead and looking where you are now?
I do all the time.
Yeah.
My wife would tell you I am guilty of this myself. But, that's one thing to look back and say, that was X amount of years ago. It was a totally different part of your life. What we need to do is make you the best that you can possibly be now and moving forward in the future. Tell all my patients, I would love to see you running around with your younger children, your grandkids, and live to 105 if possible, and not worry about, hey, I used to be a track star, I used to be a great basketball player, or what have you.
Guys, great conversation this morning. You can get more information, monhealth.com/heart. We got to run. Thank you so much, guys. Appreciate it.
Thanks, Dave.